Welcome back. During this time of social distancing and staying home, many people see getting pushed back elective surgeries as something that's in the news right now. But some doctors say that the word elective is, in fact, misleading. Today, we are lucky to have Dr. Chad Domingue, an interventional neurologist and pain management specialist. He is here to explain why we have a delay in these surgeries. And later on, we're going to be joined by two of his colleagues. Dr. Chad, thank you so much for joining me this morning.
Thanks for having me. Good morning.
Of course, I know a lot of people are talking about elective surgeries. We were talking about it before this interview. Tell us a little bit about what are elective surgeries, because when I hear surgery, I automatically think life saving.
Yeah, I think that's a great place to start. The word elective is very misleading. I think when a layman hears elective, they're thinking, a facelift, Botox, cosmetic type stuff. Elective is not that. Elective is what we use as physicians to control many chronic disease processes. Elective is not just procedures, but it's imaging, it's physical therapy, it's cardiac rehab, it's procedures such as heart stents, it's surgery for spine, it's surgery for orthopedics. And the problem is when we say elective and we stop these elective procedures, most healthcare providers are on the front line of a chronic war against chronic medical disease processes. And when you eliminate all these quote unquote elective medical options and you eliminate the staff that works by our side, a lot of these patients are left with little options to deal with their disease process.
So, how, if I need a stent, if I need some sort of elective surgery, how can I still keep my condition stable if I can't go and get the surgery?
The first part is start with a conversation, because right now, when you look at the media and you look at the coverage, everything's about the COVID-19 virus. And this conversation isn't a takeaway from the battle that the virus is giving us. But the problem that I see is these patients don't have a voice. There's nothing on TV talking about the hundreds of thousands, if not millions of patients sitting at home with heart disease, diabetes, all these disease processes that are requiring multiple medical treatment options over days and months that are now put to a halt. So I encourage patients to speak up, share their stories, contact their physicians, discuss the importance of these procedures and therapies. But unfortunately, even with all this stuff being done, with the legislation that's come down, with the restrictions from our state board, a lot of times, regardless of how we feel or the patient feels, we still can't do these procedures.
Speaking up on social media and, of course, calling your physician, two big things that I think can help out a lot of people. Now, I know you, doctor, have been dealing with a lot of patients, but two of your other colleagues have been dealing with patients as well. Let's bring them into the conversation. Joining us now as a part of this wonderful interview is Dr. Vincent Kidd III. He is a urologist, and Dr. Craig Green. He is an orthopedic surgeon. Hello, gentlemen.
How are you doing?
Wonderful. I feel so safe. I have three doctors. It's wonderful.
We have nothing else to do.
Right, but talk about some very life-saving information. Dr. Kidd, I want to start with you. Tell us about some of the stories you've been hearing, because you're a urologist, a very important practice in medicine.
Well, we have a lot of things that go on in urology as far as cancers are concerned, and the cancers have been put on hold because primarily they're not urgent or emergent type situations as far as the legislation has been concerned. And we understand that when we put somebody to sleep, if they didn't wake up, you'd need to put them on a ventilator. Well, ventilators weren't necessarily ready, so we had to put these patients on hold. So you've got patients with cancer of the kidneys and the bladder, and patients with BPH that can't urinate that have to be put on hold at this point until the elective procedures are opened back up by the government. Wow. So it's a problem for us.
It definitely sounds like a problem as well. And Dr. Green, orthopedic surgeon, we're talking about bones here, structure of our body. What are you telling your patients who are having to have their surgeries be put on hold?
Well, look, if you have a broken bone and it sticks through the skin, we'll still do that. That's an emergency. One's urgent. Let's say you have your meniscus is locked up and you can't bend or straighten your knee. A lot of joint replacements, sports medicine. Those can wait maybe 30 days, but not 3 months. And I understand from a societal standpoint, we want to balance what I think is important risk and probability. And I think early on that was a real concern, but I think if we look at the data and we're all patient advocates, I think we can start getting back to elective surgery safely with regards to what the hospital needs for PPE, as well as with regards to the risks for being contagious when you come to our office. We take huge precautions in that already, and those have been heightened. So I think it's about time we get back to elective surgeries, and patients are liking to hear that too.
Very true. Again, and it's good to know the difference between, again, if there's an emergency surgery that needs to be done, you all will take care of that. But also understanding the conversation, what is elective, I think is a very important point as well. Thank you for that, Dr. Green. Dr. Chad, you're a neurologist. Brain, very important, thing for our whole body. What stories do you have, and what do you like to tell patients who have had to have their surgeries put on hold?
Yeah, I mean, I've heard stories that crosses the gamut of medicine. I actually brought a list of some of the stories that have been shared to me over social media, and some of these stories are breathtaking. For example, I was scheduled for my cancer surgery on the 17th of April, and my surgeon called and postponed it due to the virus. My son's girlfriend's cancer radiation treatments were stopped. My stem cell transplant was pushed off until this virus passes. Dr. Green, I actually have a story here from a patient's wife who had a broken tibia where the bone was almost sticking out the skin in two hospitals on the North Shore. The administrator, not the surgeon, sent this patient home, even though the doctor said it was emergent. I have a story here of patients with neuromuscular diseases, so severe neurologic problems that are not able to get infusions of antibodies called IVIG to keep their disease process stable.
I think it's really important to note that at the end of the day, people need to understand that there is a difference between, like I said at the beginning, an elective surgery and an emergency surgery. That tibia, what? Emergency surgery. So I think the big takeaway here is to contact your doctor. If you feel like it's an emergency, contact your doctor because I think it's very important. Gentlemen, we are out of time. I could talk to you all day. Thank you so much for what you're doing for all of the patients out there.
Thank you for having us.
Absolutely. Three
Thanks for
doctors.
having us.
Of course, Dr. Chad is continuing his conversation on social media channels. Find him on Facebook and Twitter at Dr. Chad Domain or on Instagram at Dr. Chad D. He's also on YouTube. Just search for Dr. Chad Domain. Now, look, we have to take a commercial break. I really enjoyed this conversation. Stay right there. You're watching Great Things.